Welcome back. October is American Pharmacists Month, and in order to raise awareness about the work that they do, UNM College of Pharmacy is now going to be hosting a community outreach day. Well, joining us on set this morning, telling us more about that event and the work that they do in the community, we're joined by UNM student pharmacists Jose Archuleta and Lily Chiovale. Welcome to you both.
Thank you for having us.
Absolutely. And again, as we were talking about during the commercial break, happy American Pharmacist Month. So it's critical work that pharmacists do in our daily lives, because inevitably some of us have to take medication. First call right to the pharmacist. You know, is it going to conflict with anything else? Just one of many things that your curriculum and your career path is responsible for. But let's talk about what the month means and what it's all about.
Right. So October is designated as American Pharmacist Month, and that's really just meant to highlight the importance of pharmacists on the healthcare team and in the community. Pharmacists can and do play a critical role in every environment they're in, whether that's catching drug interactions at a retail pharmacy, working to manage disease states in a hospital on a multidisciplinary team. New Mexico is also unique as it's one of the very few states in the U.S. that also has a pharmacist clinician, and that's an advanced practice pharmacist that can have prescriptive authority to also work in an interdisciplinary team to help manage those disease states.
Yeah. And it's incredible. I mean, just on a day-to-day basis, as we just mentioned, that it's critical that we receive the information from trained professionals as yourselves. So let's kind of delve a little bit further into work in the community and being on a healthcare team.
Yeah, so something really interesting that we learned in school was that 90% of the U.S. population lives within 5 miles of a pharmacy. And so this means that they're one of the most accessible healthcare providers of the country. These are people who have gone through 4 years of undergraduate bachelor's experience, 4 years of a doctoral program, and then some even do 2 additional years of a residency program. And so due to them being so accessible, this can include things like medication counseling, as well as providing vaccinations, ensuring guidance for medications bought over the counter, as well as just ensuring that patients feel empowered to make the most informed decisions about their health as well.
Yeah. This event right now that's going to be hosted by the UNM College of Pharmacy, let's talk about how that's going to get folks a little bit more on the interactive level.
Yeah, of course. We're really excited about it. So Outreach Day is, of course, this Friday. So Outreach Day, the goal of that is just for the students of the College of Pharmacy. We spend the entire day, the whole student body goes out and provides services, whether that's healthcare screenings and education to the public all across Albuquerque. So the importance of this event is not only to raise awareness about the importance of pharmacists in the healthcare team, but also to raise awareness about how pharmacy expertise can help bridge those gaps in care in areas that are underserved by providers.
So for anybody wanting to interact, is it just open to the public? How does that work?
So we have a bunch of various locations all across Albuquerque, and that can go from North Domingo Baca Multi-Gen Center. We're at the South Valley Library, and that's just going to be blood glucose checks, blood pressure checks, flu vaccines, along with education on how to best manage your health, diabetes, things like that.
And again, that's happening this Friday, correct?
Correct.
All right. Something to definitely look out for, and something that you can have a chance to thank the up-and-coming pharmacists firsthand. And thank you for what you do for us, because without it, we'd be in a lot of trouble health-wise. So we appreciate it.
Thank you.
Absolutely.